aspects.
Into immunology, and to become a competent immunologist. And because I then knew that I wanted to build my academic medical career on immunology and on the role of immunology and both innate, which is called inflammation, and adaptive immunity in human disease. And at that time, the knowledge of immunology was, in my view, very limited, and I didn't want to just study in one laboratory. That in order to have a laboratory that was different from any other, I thought that I would want to put together a range of technologies and experiences. And so that's what I did. But the central theme was really inflammation, broadly, and an interest in the human disease asthma in particular. And relevant to that, during the time when I was in England with John Humphrey, I didn't actually do a lot of immunology with John Humphrey. I was attracted to somebody else in his unit by the name of Walter Brocklehurst, who was working on an unknown substance called slow-reacting substance of anaphylaxis, or SRSA. And SRSA had been discovered by an Australian group as a material that was generated in the lung of a guinea pig during an immunologic reaction that profoundly constricted guinea pig airways. And Brocklehurst, with others, had identified the same substance in human lung generated by adding allergen to the lung tissue from patients undergoing surgery for cancer, but who also had a particular allergy. And the mixture of the allergy and the antibodies on the cells in that lung caused the human lung to release this slow-reacting substance of anaphylaxis. And he elegantly showed that the human airways attached to that lung were exquisitely sensitive and contracted to it with a potency that had never really been seen before. And that contraction was resistant to all known antagonists. So it struck me that that might be a candidate molecule for the severe constriction one sees in bronchial asthma. And so actually that's one of the things I've worked on ever since. With John Humphrey, I worked on a particular cell called a mast cell because there weren't a lot of cells in which one could study immunology at that time, and I wanted to do biochemistry, and this was a cell that secreted histamine, and it seemed that studying that would be a biochemical approach to histamine release, and also an approach that I could use to study how SRSA was generated. And during my time there, another postdoctoral fellow came from Johns Hopkins, and he and I got to be friends, and he thought I should complete my training by having some immunochemistry experience at Johns Hopkins with Manfred Mayer. And so it was really Walter Reed with Elmer Becker, Mill Hill with John Humphrey and Walter Brocklehurst, and then Johns Hopkins, but always with a clinical experience included, because I did not want to lose that clinical part of my life.